So I'd like to welcome you, Dr. Suzanne Verkotteren. Is that how you pronounce your last name?
Yes.
Great. From the BC Children's Hospital Research Institute. Suzanne will be presenting on giving patients, the public, and healthcare providers and researchers a voice in pediatric biobanking. So this session today will be 1 hour in length with an optional discussion for 15 minutes at the end. I'd like to acknowledge that we're on the ancestral, traditional, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh Nations. And with that, Suzanne, I'll hand it over to you.
Thank you very much, Heather. So I hope everyone can hear me, and I apologize for my delay. Today I want to show some of the results that we have gathered over the last few years with regards to opinions on pediatric biobanking. And as learning objectives is to understand the role of biobanks in medical research, to learn the facilitators and barriers for patients to participate in biobanks, and to identify opportunities for improving the integration of research participation and biobanking into clinical care. So first of all, I want to talk a little bit about what biobanking is. And this is a long and difficult definition that was published, but it is the scientific definition. So that states that a biobank is a facility for the collection, preservation, storage, and supply of biological samples and associated data, which follows standardized operating procedures and provides material for scientific and clinical use. And some of those parts include that it's not only samples, that we also would like to include data, as well as our following standardized operating procedures, which would allow us to do everything in a standardized way. So when we share specimens, they are similar to the other biobanks as well. And all those samples are provided for scientific, but can also be used for clinical use. So when we asked the kids what the definition was of a biobank, after we've given them a little presentation, their definition of a biobank is a lot shorter, and basically they say a biobank is a bank of body bits. So what body bits are we talking about? As I said, biobanks can store anything. Words that are interchangeably used as well are biological samples or biospecimens. And examples of those are blood, urine, saliva. It can be bone marrow, cerebrospinal fluid, but also hair, skin, cheek swabs. We're interested in both normal and diseased tissues, and also in normal and diseased cells, because we need to know what is normal before we know what is abnormal. And what we noticed during our workshops is that not everyone understands that everything contains DNA, so we can actually extract DNA from all these samples. So how does biobanking work? This is a drawing that was made by Division 4, Grade 5 class at one of the elementary schools in Vancouver. And basically, biobanking contains first to get obtain consent from a patient. After that is done, we collect the sample. The sample is processed and given a unique number. Then it is stored, and the sample code and clinical information is entered. And then this will become available for research purposes. So what is the difference between a biobank and a research study? So research studies, there is only patients' consent to one study, and there is a defined research question. In a biobank, you can consent to many different types of research projects. Often when you donate your specimens and data, it is for yet an undetermined project, so you don't get to hear exactly what it's going to be used for in the future. It does add an extra layer of confidentiality, as the biobank is kind of the middleman and not the direct PI or clinician in the clinics. We hope that it will end up with a reduced number of consents, and I'll talk about that in a little bit. And again, we have a standard way of processing samples. So what is the role of a biobank in medical research? In March 2009, Time magazine published this front page article on 10 ideas that are changing the world right now. And one of the ones are biobanks, saving your parts. And I apologize for the blurry words, but that's good as it got today. So biospecimens are necessary for translational research, and when some of the surveys to researchers went out, approximately 40% of research uses biospecimens. As I mentioned, we need a standardized way of processing samples, and therefore biobanks are thought to provide with high-quality specimens. And this is a quote from one of my colleagues at the National Cancer Institute in the United States, stating that one of the most significant roadblocks to progress in cancer research is the lack of standardized, high-quality biospecimens. Now, some of it we can help, and some of the things we cannot help with, because patient factors and medications that patients take, how the medical and surgical procedures are happening, we don't have in our control. But once a sample is acquired, we can have a say in how to handle and process it appropriately, store it appropriately, and distribute it for scientific analysis later on. So biobanks facilitate personalized medicine. So they are able to do that because specimens are stored with annotated data. Also, specimens are collected throughout treatment. We often collect a germline specimen. There's also access to additional aliquots of the same specimen, and study of family members can be done. Biobanks provide secure storage of specimens and clinical data by using a specimen inventory system, clinical information that can be matched with the specimens. We ensure that all privacy standards and privacy impact assessments are in place. It is access restricted, and audits are being done. In addition, biobanks can, one patient sample may fuel numerous research projects. For example, if you have a tube of blood and you centrifuge it, there's different layers that can be used in different research projects. And often, for example, for plasma, we can get like 5 to 10 aliquots. So that means that we can support several research studies just by one blood tube. The ethical oversight and public engagement is a role that biobanks can take on by having a clear governance structure, policies around the return of research findings, policies around recontacting participants in the future. There is a fully informed consent process, and there's an assignment of custodianship. In the past, it was unclear whether it was the researcher or the institute that had custodianship. And several times when researchers left or retired, it was unclear what was going to happen with those specimens in the future. So the ongoing process of biobanking gives rise to the opportunity for public engagement. There's also a therapeutic effect of biobanking. Patients want to help, and by doing so, they feel better. This was a small research study that we did here at BC Children's Hospital in the oncology clinic, and there was the opinions of 30 biobank patients, and each respondent could select more than one response. So as you can see, the vast majority of patients felt either honorable, helpful, or hopeful by participating in biobanks. A few patients were suspicious or worried about participation. So I'm just going to briefly go over what we do at BC Children's Hospital, and then I will discuss the patient engagement that we've done over the last few years. So BC Children's Hospital Biobank was started in 2015, January 2015, and we recruit children and young adults that are seen at BC Children's Hospital, as well as pregnant women, new moms and their babies seen at BC Women's Hospital. We collect specimens and data for undetermined research studies. Specimens are usually collected as part of a medical procedure. For the BC Children's Hospital part, consent is obtained from parents, and assent is required from children 7 years old and upwards. We also need to get reconsent at the age of majority. We have a governance structure in place with many different committees, and all those committees ensure that there is an independent say on where specimens go and how things should be operated. We collect at many different clinics, including mental health, rheumatology, women's hospital, multi-organ transplants, neurology, orthopedics, ear, nose, throat, gastroenterology, hematology, and oncology. And we have a wide variety of specimens that we do collect. It can be cord blood, DNA, mouth swabs, saliva, urine, tissue, CSF, bone marrow, blood, and depending on the clinic where it's coming from, it depends on what type of specimens we collect. As I mentioned, one participant can fuel many different research projects because one sample can fuel many different projects, but also the ongoing different types of specimens we collect on one patient, as you can see here. At BC Children's, we now have over 1,200 participants with almost 3,000 collections, and then you get over 10,000 aliquots. So each collection, you get at least 3 aliquots approximately out of that. So what do we need to make Biobank successful? So to do so, we need stakeholder education and information. So we need to educate and engage the public, patients, healthcare professionals, and researchers. So what is public engagement? Public engagement is the involvement of specialists listening to, developing their understanding of, and interacting with non-specialists. So public engagement involves 4 processes. The first one is to educate, and you can educate through websites, literature, social media, presentations. You consult, so you do surveys or focus groups, and you give feedback. Make decisions, governance, deliver findings to stakeholders, and then collaborate. You have implementation and changes with the stakeholders. So why is public engagement important to biobanks? Because it educates public, it develops trust, it gives them an opportunity to provide opinions, it is a forum for discussion, it informs policy, it promotes research, it increases participation, and it develops this ongoing relationship with participants and family. So historically, the public have participated solely in a passive way as donors participants. But in the past 20 years, there has been an effort internationally to engage the public as partners and decision makers. And this is what Patrick Sullivan, who is one of our patient advocates and has helped me with some of those projects, told me. He said first research was done 2 patients, then it was done 4 patients, so we all wanted to do the best for patients, but it should be done with patients because it's really the patients and the public who can tell us best how it is done. And we always think we do the best as physicians that we're doing it for the patients, but it's better if we can have patients as partners. So what have we done thus far? One of our first initiatives was patient engagement in schools. So we did a survey where we recruited both hospital outpatients and school participants. These were adolescents aged 14 to 18 years old at the time of survey, and their parents. Parents did have to consent for the adolescent to participate in the schools. And the survey was pretty easy. It just basically asked whether they had heard of a biobank, if they would participate, if they would participate by using an extra tube of blood or an extra procedure, or only were willing to give leftover. We asked them about what age should they be assented, and their thoughts on reconsenting as well. So we had 3 different clinics, and approximately 30 to 40 patients in each clinic, as well as their parents. So we had the oncology clinic, the cardiology clinic, and the orthopedics clinic. And we chose those clinics because of their differences between the clinics. In oncology, children are diagnosed with cancers that may be fatal. Cardiology clinic often has long-term chronic patients. And orthopedics, we tried to seek out the children who had a broken arm or had a very short connection with the hospital. And we then also had 3 different schools. These were all public schools. And again, similar numbers were obtained in each school and also their parents. So the first question was, would you be willing to donate samples to a biobank? And as you can see, the clinic adolescents were more willing to give leftover specimens as well as an extra sample during a medical procedure and a sample from an extra procedure compared to their adolescent counterparts in the schools. And that was very strikingly for the parents. Parents from children who have been seen in the hospital were significantly more willing to give compared to school parents. School parents were the least willing to donate samples for the children. Another question we asked them was, what is the appropriate age for consent? And these are the adolescent numbers. The blue is the clinic and the orange is the schools. And the median age was about 14 years of age. That was the appropriate consent when we asked adolescents. And there was no difference in the clinic or the schools. When we asked the parents, again, there was no difference between clinic or parent schools, between clinic or school parents. And their median age of assent was 16 years. And you can see that a significant amount of parents still said that it was okay to get participation without the children's assent. We asked them whether it was okay if we could use still the specimens in the absence of reconsent. Right now we do have to reconsent at the age of majority, but sometimes that's hampered by the fact that we cannot get responses or people have moved. So adolescents thought continued use was acceptable compared to the parents. So parents were less willing to let their children's leftover samples being used without their reconsent. These findings have been published in the Journal of Adolescent Health in 2016. Then we were wondering whether the difference between the clinic patients and parents as well as the school parents and adolescents was due to the fact that patients in the clinics were more educated about research. And so we wanted to do the same survey, but then see whether education in advance would change how school adolescents and parents would respond to the survey, or increase their willingness to participate. So we surveyed adolescents in high schools before and after giving them a 15-minute education session, which consisted of the Biobank video and a PowerPoint presentation, and surveyed parents of high school students by asking them to watch our Biobank video first. So the number of adolescents and parents without any prior education was almost 200. And the number of respondents to the survey with an education session, we had 100 adolescents, and we only had 44 parents. So when we asked them the willingness to donate samples under various conditions, so either leftover sample, extra sample, or extra procedure, on the left ones are the ones with prior education, and these are the ones without prior education. But there's no difference in willingness to donate with or without education when we looked at the adolescents' replies. When we looked at willingness to donate samples under various conditions, when we looked at the parents, there actually was, this is the one with the education, and this is again the ones without education. And parents with prior education are significantly more willing to donate compared to parents who had no prior education about biobanking. When we asked them again the question about appropriate age of assent, so the median age without education previously was 13 to 14 years, The median age with education for adolescents, they say now it is lower, it is 10 years, which is kind of expected because now when you explain it to them, they felt more part of the process and they thought they should be included earlier. However, when we asked the parents, there was no significant difference in their age for assent. The median age with education was 14, and the median age without education was 15 years of age. So still significantly different what we do at BC Children's Hospital, as we have the age of 7 years. Another question that I have the results here from is, in the absence of reconsent, can your samples be used? These are the adolescents and these are the parents. And there was no significant difference for the adolescents. Just over half the patients or the adolescents said yes, you can use it, and approximately 20% of the adolescents say no, you cannot use it. And there was still a significant amount of adolescents who were uncertain about this. When we looked at the parents, there is a significant increase in the number of parents that says yes, you can use the sample without reconsent after education. So the next part of our public and patient education campaign was a focus group initiative that was funded by CIHR's Poor Patient Collaboration Grant and the BC Children's Hospital Foundation. So this was a large team of members that helped me with this research. So I'm there at the top, but I'm Patrick Sullivan, a patient advocate and chair of the Advocacy for Canadian Oncology Research Network. Isabel Jordan from the chair of the Rare Disease Foundation. We had Alice Varani, who is the director of ethics services here. Ellen Chesney, chief administrative officer for research. Shazan Ahmed, who is an endocrinologist and as passionate as me about engaging patients. Sheila O'Donoghue, who works for the Office of Biobank Education and Research, as well as Tamsin, our administrative manager, Michelle Dittrich, research program manager, Heather and Tram were our students. So the objectives were to engage the community as partners in research, to understand patient and public opinions on biobanking practices, understand needs and opinions of clinicians and researchers, and we compiled this into recommendations and with the hope to improve biobanking practices. So we gathered the information and opinions from patients, families, and biobank participants, the general public, as well as clinicians and researchers. A total of 46 patients participated, and we had 3 different groups. We had adults, we had teens from 14 to 17 years old, and kids 11 to 13 years of age. We had 25 members of the public, again adults, teens 14 to 17 years old, and kids 11 to 13 years old. And 22 healthcare providers participated, and those were doctors and researchers, and they were all over the age of 20. So public and patients, they all had very similar ideas about research and biobanking. One of the questions we asked them is research important to you? And patients, research is important for altruistic and personal reasons. But they did realize that most research would be likely too late to benefit their own child. For the public, research is very important for the future of healthcare, so they have a more general idea about it, whereas patients really want to focus on their own diseases, and hopefully that benefits their own group of patients. And then we asked them the next question: why would you or your child want to participate in a biobank? And adults said, I would say yes to anything if another mom wouldn't go through what I did. And biobanks should be involved at all major hospitals. One of the nice kids quotes was, why would you incinerate or bury people when you can help others in research? So concerns that were brought up by both the public and the patients was misuse, quality control, or the non-use of samples. There was definitely concern about they give something and nothing comes out of it. Worries was about the lack of patient samples and the need, especially in the pediatric world, to work together with other biobanks, as most of the diseases in children are rare, which is a good thing, but it makes research harder. One of the concerns was the lack of collaboration among staff and researchers. Sometimes they felt that some clinicians don't want to participate. They don't want to bring it up to them that there are research opportunities. And sometimes they felt that staff and researchers are kind of fighting over the same patients and the same resources. The lack of patient involvement. There was concern about private industry, and this is mostly with regards to the mistrust due to profits, although some parents were really keen on giving it to private industry as they realize that most of the new medications are coming from industry. Return of results, and this is not necessarily their own results, but just a general idea of what is happening with biobanking specimens, and increased communications between researchers and doctors and patients, and privacy. However, they all said that the benefits significantly outweigh the concerns. So they realized that these are all concerns, but when they were given a choice, they would all way rather participate than not participate. So how do you feel about health information and biological samples being used for research? And with health information, we meant name, healthcare number, age, gender, language, medical history, treatment and diagnosis information. So participant answers with regards to data. Although data security and privacy risks were acknowledged, again, patients were very willing to accept these risks, and they far outweighed by benefits. One of the quotes was, "You intellectually understand the risks, but the benefits in your mind outweigh those risks a lot. The reasons not to participate are more far-fetched than the reasons to do it." And teens said, "The hospitals already have all that information about you, so I wouldn't really care." With regards to getting the samples, kids, as not so surprisingly, are worried about needles. What information is important to hear when you are being asked to participate in research? So this is with regards to the consent process. Adult said, "Do you want to participate in further research to help others? Check. Put this in front, and that's all we need to know. Awareness before coming to the hospital would be extremely helpful." And this was not so helpful. This is our Biobank consent form. I think I managed to get a glimpse of 7 of the 11 pages on here, but you can clearly see that this is really unappealing to read before you're undergoing a medical procedure. And this was one of the major things. It's that it's really difficult to read these consent forms. We also asked them what type of feedback they want to hear after you donate to the biobank. And this is extremely important, and I think especially here we don't do a very good job at. And for the patients, this is very meaningful, and they morally expect it in return for giving the researchers valuable information. One of the quotes was, "Scientists are used to go getting the information and never feeding back. Part of what is going to drive them to change is hearing, 'Hey, we are giving you something precious. There is a quid pro quo.' All researchers need to give feedback on their results." And then we asked them, like, how would you like to hear back about biobanking research? And we gave them 5 options. A personalized app login, and this is especially for the younger generations, seem to be very popular. Passive forms like website, social media, or logging in on something where they have control over were more preferred than phone calls or personal emails. We asked them the question, do you trust biobanks? Kids trusted the hospital because it is a community that works to help people. So having biobanks within hospitals was significantly more trustworthy than privately operated biobanks. parents said having the choice to participate and to withdraw at any time makes one more inclined to participate. Being asked by a doctor or someone you trust to participate, and knowing that the biobank is governed by ethics and affiliated with a hospital help them trust biobanks. And we had some discussions about other issues with regards to biobanking. As I mentioned, we also asked doctors, nurses, researchers about concerns. So the barriers that were identified on this site were lack of research culture, the time, and this is especially for nurses and doctors, the time it takes to go through consent forms or to identify possible suitable donors, ethical barriers. Both doctors and researchers brought this up, that they feel that some of the ethical criteria to participate are so difficult that they don't go through with it. Length of consent forms. Doctors and nurses are sometimes unaware of studies and biobank, and they sometimes don't see the need or the usefulness of those particular things. A major issue, of course, is the unethical circumstances to consent, capacity, rare diseases, and the erosion of informed consent. And often there's only a small window of opportunity to consent for diagnostic samples, and those are more often considered the very helpful samples for research purposes. Facilitators included leftover samples, research consenting champions, sharing of valuable clinical samples, and therefore there is an increased availability, reduced consent burden, and good governance. So similar to that is that research concerns included lack of samples. Several initiatives failed due to the lack of samples and need for control samples. So in children especially, having normal control samples is extremely difficult, because healthy children do not visit the hospital, and healthy children are not so happy to have pokes for no specifically good reason. Another reason is the competing with pharmaceutical companies that pay way more money for clinical trials. We need a better consenting system, including universal consent. Knowledge translation training needed. As researchers say, they don't really know how to feed back information to the public and patients. Again, the too many ethical regulations, the consent forms, and that's a major issue still. And the prioritization studies with newly diagnosed patients. They say that the clinician always has first dibs at their own patients, although their research may not be seen scientifically as good as other research studies. Therefore, an overall improved institutional culture of research and physician support is needed. So we need to create a culture of research. Interestingly, in one of the public workshops, the opt-out consent model was suggested, and I don't think we're close to that, but it is definitely something that the words are being floated more and more. We need to share patient stories and quality improvement statistics and show patients what we're really doing and how they help. Social media, posters and pamphlets. We are dealing at BC Children's Hospital with a very young population, and we have to use the methods that they like to be learning things from instead of to make it more appealing to them. Increase knowledge translation efforts together with the researchers, the physicians, and the patients. Prioritize resources for research, giving like nurses and doctors time to introduce research to patients. Education of all staff on research duties, and all that together will promote a culture of research. So some of the things I've been working on over the last 2 months since we have finished the workshops is this awful biobanking consent. One of our, I was lucky enough to be introduced to one of an Emily Carr student who has major interest in this, and she has designed this new BC Children's Hospital Biobank information and consent form that looks significantly better, I think, compared to the one we're currently using. I have given this to several parents to look over and parent groups so that we can get feedback before I try to get this through ethics. And I'm also going to present these in a school to see if the language is appropriately. But you can see there is all kinds of information still there, but it is done in a nicer way. So we need long-term awareness promotion ideas, social marketing, buzz ads people came up with, UBC and SFU developing campaigns, blog posts and stories, stickers and posters. We need to think about events to collaborate with Science World or Gearing Up. General education sessions, talk to the doctors and nurses, visibility in schools, conferences, and also give participants incentives. It is ridiculous that people who are coming here to volunteer for something have to pay for their own parking. And little things like a sticker or a coloring book goes a long way for small children. So we're currently working on more patient stories and educational pieces and see how we can get a better visibility on social media, continue our engagement reaching by using an online platform, make more educational pamphlets. One of the things that was also suggested was a comic book explaining what a biobank and research is, promote messages of what samples are being used for, how biobanks can help, and patient stories. Why do we care about, or why do we biobank? We have a little video on our website, and that was used also for the educational purposes in the schools, if you're interested. It is on our website, bcchbiobank.ca. There have been a lot of people that have helped me with everything I showed today. What I haven't shown you today is that we did something very similar in the mental health clinics here at BC Children's Hospital, and that we actually got very similar results with that mental health patients, pediatric patients, really would like more research done, as they believe that their only way to cure is that if they have a good diagnosis and when we can look at better treatment options for them. And if you have any questions, you can either ask them now, or you can also directly email me at my email address that is on this slide. And thank you very much for your attention.
Excellent. Thank you so much, Suzanne. That was a fascinating presentation. I was really interested actually to see the section on the updated consent form, just because it's such a hot topic.
Yeah.
So I'm really keen to see what happens with that if you want to keep it updated.
Absolutely. Yeah, I actually have several meetings here because I gave it to some other people as well, and they were like, "Oh, that looks so nice. It looks so much better." And so I actually have another meeting next week with someone from here as well to improve our consenting processes in general, not just for me, but not just for the biobank, but for research in general.
Absolutely. Rebecca, I know that you're online. I just wanted to check in with you if you had any questions or comments for the presenter.
Oh, sure. First, thanks, Suzanne. I knew for a while that you and Tamsin were doing this work, so it was nice to hear your presentation about what it entailed, and also nice to hear that you got one of the CIHR collaboration grants. That is fantastic. Yeah, thank you guys. Yeah, and really, I think, through a grant like that, you're able to do this in like a much more thorough way than some of us have tried here and there over the years. So that is fantastic work. I guess my question is just if you have any ideas on how to now use the evidence that you guys have generated to actually maybe change or reduce some of the, administrative burden or attitudes of some of the people, entities that we have to get approvals for these kinds of activities. Have you guys thought about how you might kind of make it change, have that kind of impact, I guess? Yeah,
so I think I'm actually going to present these data in a white paper to our CEO of the hospital here, Susan Wanamaker, as well as like our presidents of the research institutes as well. I've been involved now, as you may have heard, the permission to contact. A lot of things are changing. I think the ethics boards are slowly starting to think and see some evidence that the way we approach patients is really not conducive for a true informed consent. Like, I have the feeling that patients right now either say yes or no, just like either they trust you or they don't. And they definitely don't read the 11-page consent form. So I think that the ethics boards are slowly starting to realize this. I have been approached by the BC Cancer Ethics Board about this as well. And they seem to take a lead in a more innovative way, and I hope we will follow here as well. I think changes in the privacy offices, again, with how many double layers there are. And I have the feeling that there is a feeling now that people want to collaborate more and working. Like, since I've been doing this over the last few years, the use of the biobank has gone up significantly, and I think people start seeing the value of it more. So I do believe there's changes in the air, especially when it comes down to ethics and privacy laws, but it's always slow, these things.
Yeah, it's so true. And I spent the morning, actually, we had a presentation from Tom Noseworthy from the AHSN over here in Victoria, and we were talking about a lot of topics, but one thing that came up, we were talking about privacy, actually, and we were talking as a group about how, we only really talk to the public around, and, there are different governing entities like privacy offices around the risks of doing the activity. But we should maybe try flipping whenever we can to talk about the risks of not doing it, right? And we were talking about it in the context of health data, but I think it's really applicable to biobanking. And when you think about, especially like pediatric cancers, I mean, oh my gosh, if this research wasn't happening, the standard of care today would look so much worse. So.
In 45 years ago, like if you had a diagnosis of childhood leukemia, that was your death sentence. And now we cure 90 to 95% of the children are cured now. So, research really has a huge role. And, we need to make people aware that even something so simple as a Tylenol has been studied. And we use that every day or, on a not irregular basis. And I think when we make people aware of the small things that were all created through research, I think then they see the value more.
Absolutely.
But I also... What our patients said is that they would love to make a video for nurses and doctors to convince them to ask them to participate, or that they shouldn't be worried about offending them. And so I know,
and that's just the thing. I've had this debate with lots of different clinics here at Island Health in regards to our permission to contact program. And, for instance, nurses not wanting to ask families the question because they feel it's burdensome. And what I've tried to gently remind them is actually that's very unethical and paternalistic for them as a healthcare provider to be deciding, to be making that decision, in essence, for the family. So it's just, everyone's trying to do their best, but sometimes people just need to kind of be, just to have a bit of a step back and a broader perspective on what the purpose of these activities actually are. And then the only other comment or thought that I had is that you should think about maybe connecting with somebody from the BC Ethics Harmonization Initiative. That might be a good way for you, if you got those folks to kind of maybe, agree to your changed up consent forms, those kinds of things. That might help get it through to the other health authorities as well.
That's a great idea,
Yeah, and I know here at Island Health, the manager of our research ethics office, Terry Fleming, has been one of the key people on the BC Ethics Harmonization Initiative, and she is a really great champion, making sure that, requirements and privacy and ethics and all of those things are looked after, also seeing it from both sides. So she might be a good connection point. So if you don't know her and want to connect to her, just send me an email and I can connect.
Oh, great. Thanks, Rebecca. That's great.
Okay, but thanks again. This was really good work.
Thank you.
Thanks so much, Suzanne. That was a wonderful presentation.
Thank you very much. Have a good day, everyone.
Okay, bye.
Bye-bye.